Welcome back, champ! Big props for fitting this study session in. Let's tackle today's questions about DNA viruses and boost your brain while you keep owning your day. Question 1. Which DNA virus is the main cause of pharyngoconjunctival fever in children? Adenovirus. Question 2. A 4-year-old presents with severe bilateral conjunctivitis during an outbreak at her daycare. Which DNA virus is most likely responsible? Adenovirus. Question 3. BK virus is known to cause which complication in kidney transplant recipients? Polyomavirus-associated nephropathy. Question 4. JC virus reactivation is most notorious for causing which CNS disease in immunocompromised adults? Progressive multifocal leukoencephalopathy, PML. Question 5. Epstein-Barr virus infection is commonly associated with which hematological finding? Mononucleosis with atypical lymphocytes. Question 6. A vesicular rash that appears first on the face/trunk before spreading to the extremities in a child suggests infection with which DNA virus? Varicella-Zoster virus. Question 7. Which of the following DNA viruses can be transmitted through fecal, oral, and respiratory routes? Adenovirus. Question 8. The smudge cell seen in histopathology is characteristic of infection with which DNA virus? Adenovirus. Question 9. Which enzyme do herpes viruses encode to enable viral DNA replication? DNA-dependent DNA polymerase. Question 10. Which DNA virus can be shed for weeks in stool even after respiratory symptoms have resolved? Adenovirus. Question 11. Roseola infantum, 6th disease, characterized by high fever followed by a lacy rash as fever breaks, is caused by which DNA virus? Human herpes virus 6. Question 12. What is the major capsid symmetry found in most DNA viruses? Icosahedral. Question 13. Which DNA virus is known to induce bladder hemorrhagic cystitis, especially in children? Adenovirus. Question 14. Transmission of cytomegalovirus most commonly occurs via which route? Saliva and body fluids. Question 15. The owl's eye inclusion is pathognomonic for which DNA virus in tissue biopsy? Cytomegalovirus. Question 16. Which DNA virus is most closely linked with Burkitt lymphoma in endemic African regions? Epstein-Barr virus. Question 17. The lytic cycle of which virus family leads to smudge cells and cytolysis in epithelial tissues? Adenovirus. Question 18. Kaposi sarcoma is most commonly seen in immunocompromised individuals infected with which DNA virus? Human herpes virus 8. Question 19. A pregnant woman is exposed to slapped cheek disease. What is the major fetal risk if infected in the first trimester? Hydrops fetalis. Question 20. Which of the following DNA viruses often causes exudative pharyngitis in children and should be considered in the differential diagnosis of strep throat? Adenovirus. Question 21. Which DNA virus family is capable of causing latent infections of sensory ganglia? Herpes viridae. Question 22. Human herpes virus 8 is associated with what neoplasm? Kaposi sarcoma. Question 23. A patient presents with painful genital ulcers and tender inguinal lymphadenopathy. Which DNA virus is most probable? Herpes simplex virus 2. Question 24. Which DNA virus can cause myocarditis and pericarditis, particularly in immunocompromised patients? Adenovirus. Question 25. What viral characteristic allows pox viruses to replicate entirely in the cytoplasm? Encoding their own DNA-dependent RNA polymerase. Question 26. Which virus causes teardrop vesicles on an erythematous base, often described as dewdrops on a rose petal? Varicella-Zoster virus. Question 27. What is the primary mechanism of immune evasion for cytomegalovirus in infected hosts? Inhibition of MHC class I presentation. Question 28. Which DNA virus is best known for causing acute hemorrhagic cystitis in children and can also cause respiratory and gastrointestinal illnesses? Adenovirus. Question 29. Neonatal herpes infection is most commonly acquired during which period? At delivery through infected birth canal. Question 30. In solid organ transplant recipients, which DNA virus is most associated with interstitial nephritis? BK virus. Another round done, legend. Keep crushing your day. I'm Amir, and I'll catch you in the next session.